Breathing control can be done as part of active cycle of breathing. However, it's also a standalone treatment itself. You may see it referred to as abdominal breathing, belly breathing, or diaphragmatic breathing. However, these terms we avoid with our patients with COPD, and we'll come back to that in a minute. The aim is to achieve relaxed breathing with minimal effort. Breathing control can be used in the acute and chronic setting. Acutely, if someone's acutely short of breath, we can use it to help them restore normal respiratory rate. And also, if a patient's looking to regain control of their breathing when they're out and about, breathing control can be used. It's commonly used in conjunction with other treatments such as positioning. It's shown to decrease oxygen consumption, increase gas exchange, increase functional capacity and exercise tolerance, and ultimately increase quality of life. We're now going to look at how we would carry out breathing control. Before you start, your patient should be in a comfortable position, referring back to what we've just spoken about with positioning. So relax the shoulder and neck muscles and try not to let the patient hold their stomach in. They should place one hand on their chest and the other on their abdomen. Instruct them to breathe in smoothly through their nose. They should feel their abdomen rise a little. Then ask them to try and breathe out through their nose, and as they do, they should feel their abdomen fall. Some patients find it helps them focus if they close their eyes while they're carrying out breathing control. For some people, they may find counting can be helpful. I find this particularly beneficial in the acute setting if a patient's been struggling with their increased respiratory rate, as it helps them to focus on their breathing. Try and get them to sync in with their pattern as much as you can by using your voice and help them to slow it down. This is also helpful to those with chronic conditions, as they can use it to help stay in control of their breathing during activity or after activity. You can use counting like this. In, 2, 3, out, 2, 3. In, 2, 3, out, 2, 3. In, 2, 3, out, 2, 3. This technique can be done in any position, so sitting, standing, lying. However, always make sure you're maximising the length-tension relationship of the diaphragm and minimising the use of your accessory muscles, as this will aid the effectiveness of the technique. Diaphragmatic breathing in particular is recommended. It's not carried out in patients with severe COPD, as it can actually increase their feelings of dyspnea. This is due to the change in their breathing pattern. So these patients tend to breathe more apically. So it causes an increase in the respiratory load and puts them at a mechanical disadvantage. With these patients, you want to focus on slowing their breathing rate down, and this can be done by counting or focusing more on their out breath, or we can use something called rectangular breathing. Rectangular or square breathing is a form of breathing control. As with all treatments, you want to make sure that your patient's in a good position before you start. The patient should focus on an object in front of them that can be a rectangle or a square. The reason rectangle is commonly used with this patient group is that we want to focus more on the out breath. So the patient would breathe in on the shorter edge and out on the longer edge. They would gradually slow their breathing down. Square or rectangular breathing. Your patient should be in a comfortable position, minimising the use of the accessory muscles. This can be used in conjunction with other techniques such as pursed lip breathing. Look for something which is square or rectangular to focus on. This can be something on the wall, the TV, or even just the window. Evidence supports the use of breathing control at rest to see if it helps a feeling of dyspnea. It's also strongly recommended that patients with COPD should not routinely be taught diaphragmatic breathing.